It was an interesting meeting. I think probably the most interesting data was in mantle cell lymphoma. So, there was the US intergroup study led by ECOG that showed for patients who were MRD negative and PET negative at the end of induction therapy, there was no benefit to adding an autologous stem cell transplant to maintenance rituximab, which supports the prior triangle study, though that asks a different question. But I think that's really a big step forward in mantle cell lymphoma. As we know, stem cell transplantation can be associated with significant toxicity. So that was pretty exciting, and a lot of, more data with bispecific antibodies and combinations. And I think the overall message in lymphoma is, there's been a lot of innovation in the past, 5 to 10 years, and we're really seeing amazing improvements in outcomes across the board for B-cell lymphomas. We still have a ways to go for T-cell lymphoma, and Hodgkin lymphoma we've already talked about, but, our patients generally do really well. So it's a pretty great time to be a lymphoma doc, I would say.